Your body can actually heal sciatic pain caused by a herniated disc on its own. This process is called disc resorption. Understanding how it works can help you take control and recover quickly. If your doctor hasn't mentioned it to you, stick around and I'll explain. Here is a bit of science. The sciatic nerve is the longest nerve in your body, running from your lower back down to your feet. When a disc in your spine herniates or bulges out, it triggers your body's immune response, causing inflammation in the affected spinal segment. This inflammation leads to swelling and pain. Your immune system recognizes the bulging part of the disc as a foreign object in the spinal space. Over time, your body naturally absorbs the herniated part of the disc, relieving pressure on the sciatic nerve. It's a remarkable self-healing mechanism that often doesn't require surgical intervention. While your immune system works hard to absorb the herniated part of the disc, your body reacts to the local inflammation by sending pain signal to your brain to prevent further injury. Your brain initiates muscle spasm to stabilize the segment. At this moment, you experience excruciating low back pain shooting down your leg. This pain is always sudden, unexpected. Your next steps are crucial for your prompt recovery. First of all, don't panic. The pain feels terrible, but it's not as scary as it seems to be. Your body has already started the healing process. Find a comfortable position. By the way, what's your go-to position when you're in pain? Leave a comment below. Your advice might help someone else. If you can tolerate the pain without medications, that's great. If not, use over-the-counter painkillers that usually works for you, or contact your doctor. Take it easy and avoid any movements that can aggravate the pain, such as bending forward, extending your spine, rotating, or side bending. However, don't stay immobile. Get up and move gently. Do simple tasks around the house. Avoid the following activities: weightlifting, running, jumping, stair climbing, swimming, or stretching. Also, avoid prolonged sitting, standing, walking, or driving. As I tell my clients, the force of gravity works against you right now. Try to minimize its effect. The rule here is, if you have the opportunity to stand up, sit down. If you can sit, lay down. The following modalities aggravate acute sciatic pain: high velocity, low amplitude movement techniques, inversion tables, deep tissue massage, cupping, foam rolling, hot packs, TENS machines, acupressure mats, electrotherapy, and shockwave therapy on the lumbar area. Other activities that aggravate acute sciatic pain: yoga, gym, sauna, or hot tub. Daily activities that make your pain worse: laundry, house cleaning, vacuuming, grocery shopping, picking up small children or pets, snow shoveling, gardening, and bending forward to get something from the floor or refrigerator. What helps? Rest. Give yourself 2-3 days, listen to your body, and start walking slowly as soon as you can. If you can walk for 2 minutes, walk for 2 minutes. If you can walk for 5 minutes, walk for 5 minutes. Walk on a flat surface wearing comfortable shoes and avoid stairs. The goal here is to move gently and avoid movements, activities, and positions that aggravate your pain. Learn about proper sleep position for sciatica here. Effective treatments for acute sciatic pain include physiotherapy, osteopathy, acupuncture, needles only, laser therapy, ultrasound therapy, and cold therapy. Share in the comments if you have tried any of these treatments. Timing is important here. It will take 1 to 2 weeks for you to feel better, but recovery will take longer. The disc is a vascular structure, meaning it doesn't have its own blood supply and therefore relies on diffusion for the delivery of oxygen and nutrients. The timeline for healing can vary significantly depending on factors such as the degree of your disc herniation, your overall health, and the effectiveness of your treatment. For your information, it can take 3 months to 9 months for the disc to heal properly, sometimes even longer. However, it doesn't mean that you have to be inactive all that time. Start with light exercises like static planks from your elbows, static glute bridge, gentle hip stretching, and sciatic nerve flossing exercise 4-6 weeks after the injury, and progress slowly. You should be able to return to your normal routine by the 10th or 12th week after injury. You can find a sciatic nerve rehabilitation program in the community tab. Now, let's talk about your work condition. If you are an office worker, adjust your ergonomics at work. You can find useful tips in the YouTube community tab. Incline your chair, ensure you have good lumbar support, and get up and move every hour. Ideally, reduce your working hours. If you can work from home, do so. If your job requires weightlifting, prolonged standing, walking, or driving, it's better to take a break from work for a minimum of 2-3 weeks, ideally 4-6 weeks. Otherwise, it will be difficult to recover properly and you risk re-injuring yourself. Chronic disc herniations form scar tissue and calcification, making the resorption method ineffective. Sometimes surgery is the only option there. I hope this information was useful for you. If you have specific questions about managing sciatica sciatic pain or the recovery process, drop them in the comments and I'll address them as soon as I can. Please share this video with your friends and family to help them prevent any complications. Stay healthy.